Okay, so good morning, ma'am. My name is Meryl Joyce Colong. I am a second-year medical student from Davao Medical School Foundation, and today I am in charge of performing the physical examination of the baby. So, ma'am, may I know po your name as well as your relation to the baby? I am Solen Yusaf Bolzico, mother of the baby. Okay po, so good morning po, ma'am Solen. Okay, may I know po the complete name of the baby as well as the age of the baby? So, her name is Tilly Bolzico. She is 4 months old. Okay po. So, for today's examination, ma'am, no, it will be comprised of assessment of the nose, the mouth, the neck, the thorax and the lungs, the heart, the breast, as well as the abdomen. Okay, so I will be explaining it all in details na as we go along with the examination. Okay, so I would like to ask for consent po, ma'am, to proceed with the examination. Yes po, Doc, pwede na po kayo mag-start. Okay po. So, first po, ma'am, no, I will be assessing, no, the nose. So, starting with the nasal septum. So, upon inspection, the nasal septum is at the midline. And also, I will be checking for the discharge. Sandali lang, baby, ha? Okay, there are no discharges, no, on both nostrils. And then next, I will be assessing the patency of the nasal passage. Okay, so far okay naman po, Ma'am Solen. So now we will proceed with the assessment of the mouth. So I'm going to ask you, Ma'am Solen, to hold the baby, okay? The baby's arms as well as the head. Okay, thank you. So I will be using sound depressor as well as the pen light, and also assuming that I am wearing gloves. Okay, so sandali lang po. Okay, so I will be checking, inspecting the mouth of the baby. So there are no teeth present, no, and then to loose. And also, the alveolar mucosa is smooth and finely serrated, has finely serrated borders, no. But I can also notice here, ma'am, no, tiny white teeth-like structures. So these are actually cysts. We call them the Epstein pearl, which is actually normal and will eventually subside, no. Subside 1 to 2 months, after 1 to 2 months. Okay, so I will be also inspecting for cleft palate and cleft lip. So, wala naman po. And now, ma'am, I will be inducing gag reflex. Okay, so there you go, we have the gag reflex. Okay, so after po sa assessment ng mouth, we will now proceed with the neck, no? So I will be checking for enlargement of lymph nodes. Okay, so far wala naman po, ma'am. And then after that, no, I will be also assessing the placement of the thyroid cartilage as well as the trachea. Okay, and then also I will be palpating the clavicle to check for any evidence of fracture. Okay, so far po, ma'am, wala naman po. Okay naman po lahat. Okay, now we will proceed with the assessment of the thorax and the lungs. Okay, so I will be inspecting first, no? I will be doing inspection first. So upon inspection, no, there is a symmetrical chest expansion on both sides. And also, assuming that I have been observing the baby for 30 to 60 seconds. Okay, so the baby does not show any sign of cyanosis. And there is no, the respiratory rate is 40 cycles per minute. And there is no nasal flaring. There is no audible breath sounds, no grunting, and no retractions noted. So, upon inspection, no, the baby does not show any sign of respiratory distress. Okay po. So, next, I will be doing palpation, no? I will be assessing the tactile fremitus. So I'll be using my hands. Okay, so there is symmetry no, in the vibration. No? Okay, sorry po. Okay, sorry po. Okay, so next, no, I will be auscultating po. I will be checking for the breath sounds. No, I will be first auscultating the upper airway and then followed by the lower airway. Okay, so upon auscultation ma'am, no, there were no any there is like clear breath sounds. Okay, clear naman po yung breath sounds. No wheezing, crackles, or wrong cry noted, no, sa baby. And also, the upper airway, the breath sounds are symmetrical. Okay po? So now we will proceed with the heart, no, so, or the cardiovascular assessment. No? So for the cardiovascular assessment, I will be first doing an inspection, and then followed by the palpation and then auscultation. So upon inspection, ma'am, no, the baby is not cyanotic. There's no sign of pallor, and then there's also no sign of irritability, tachypnea, and fatigue. Okay. So now I will proceed with the palpation. Now I will be checking for any possible presence of thrills. So I will be using the palm of my hands. Okay, so far wala naman po akong thrills na napansin. So now I will proceed with the auscultation. Okay, so I will be checking for the heart rate as well as any presence of murmurs. Okay, so upon auscultation, ma'am, no, the baby has a normal sinus dysrhythmia. It is actually common among infants, no, and meaning to say there is there is increased heart rate, no, during inspiration and decreased heart rate during expiration. Okay, which is actually normal po among infants. And also, the heart rate is 142 beats per minute. And in the mitral area, the S1 and the S2 are distinct. Okay, and also there were no murmurs, no. Wala pa akong napansin ng murmurs na during auscultation. So next na we will proceed with the breast, no. I will be inspecting first the breast. Okay, so upon inspection, there are 2 nipples. There are no supernumerary nipples. Okay, and also no breast discharge noted. Okay, so now we will proceed with the abdomen, no. So as for the shape of the abdomen, it is a globular, and aside from that, no, there are no redness or swelling, no, noted sa umbilicus area. Okay, now I will be proceeding with the auscultation. I will be checking for the vowel sounds. So, upon auscultation, I can hear tinkling sounds po, ma'am. Okay. Then next, I will be doing the palpation. No? I will be palpating the 4 quadrants, and also I will be checking for the position of the liver. Okay po. So, I will be holding the lower extremity, no? The knees and the hips are flexed. Okay, now I will be palpating, starting at the right lower area of the abdomen, going up to check for the liver. Okay, so around 1 to 3 centimeters, no, below the right costal margin. Okay, you can feel the lower border of the liver. Okay, on the other side, to check for the spleen. Okay, so just right below the left costal margin, I can feel the spleen. Okay. Okay, so to summarize po our examination, ma'am, no, so far, wala naman po any abnormalities, no, for the nose, okay ng patent naman po yung nasal passage, for the mouth, although may nakita po tayong Epstein pearls, but these are actually normal and they normally subside 1 to 2 months after, no? And also for the neck, wala naman pong displacement of the thyroid cartilage or trachea, wala naman pong enlargement of the lymph nodes, no? Wala rin pong evidence of fracture for the thorax. Wala naman pong any sign of respiratory distress. Symmetrical naman po yung for the tactile fremitus. Upon auscultation, clear breath sounds. Wala pong kailangang ikabahala. Okay po. And also, for the heart, no sign of cyanosis. No? Also, there were no thrills, no murmurs noted. Okay. And, yun nga po, meron pong normal sinus dyspnea, which is actually normal and common among infants, no? And also, for the breast, no, there were no abnormalities. Wala pong extra nipple, wala rin pong nipple discharge. And for the abdomen, normal naman po yung vowel sounds, which is tinkling, which is normal vowel sounds, no, among infants. And also, delication of the liver and the spleen are okay. So, do you have any questions before we end our examination? None po. Okay, so thank you so much. Okay, thank you so much, Lee, for cooperating with us. Okay, so if you have any concerns, feel free to go back here. Okay po. So have a great day po.